My name is Kevin Malley, a recovery worker for Change, Grow, Live Nottinghamshire. We want you to stay safe and well during this time, so we are producing advice on helping you address medication use that may have gotten out of hand. Medication plays an important part in our lives. However, sometimes we enjoy the effects of them to the point that we form a negative bond with them. We will be looking at why do we get addicted to medication, how we can safely reduce the amount of this medication that we use, and how to cope with the negative emotions and negative physical feelings that come when we try to change our substance use. Why do we become addicted to medications? We are exposed to drugs that have medicinal effects, but also have desirable psychoactive properties. These are also known as highs. Over time, the medical reason for taking the drug passes, but we continue to crave the desirable side effect of these drugs. We may start using above our prescribed or recommended dosages to achieve the effect that we are seeking. As we started using the drug for what we saw as a legitimate reason, we can convince ourselves that we need the drug rather than want the drug. At some point, we come to the realization that we have lost control over the drug. This may manifest as going to multiple pharmacies to avoid restriction on sale on certain over-the-counter medication, looking to repeat our prescription earlier due to the fact that we've used above the recommended dosages, or seeking the drug or similar drugs either online or through street drug sales. How to start to safely reduce. If your medication is being prescribed by your GP for an ongoing condition, please speak with them about what has happened and include them in any plans you have made. Be honest about how much you take daily. This will be your starting dosage. Do not try to start lower than you can handle. For this to work, you will need to remain as comfortable as possible. Plan when you will take your medication throughout the day. Structure will help with craving management. Inform people who care for you what you are doing. This will help them support you while you recover. Identify activities you can do during this time that give you pleasure. The less you think about the process of reducing, the less stress it will cause you. Planning your reduction. Different medications stay in your body for different amounts of time. Their half-life is the amount of time it takes for half the drug to be processed by the body. The half-life of medications can vary between individuals due to factors such as health, size, gender, and the amount of time the drug has been taken for. You will need to find the half-life of your medication, as it will influence how often you can space your dosages and how often you can reduce. The longer the half-life of a drug, the further your dosages can be spaced out. Drugs with longer half-times also need to have your reductions spaced further apart than those with short half-lives. Some examples of half-lives are opiate medications, which vary from 2 to 24 hours. Benzodiazepine medications vary from 4 to 200 hours. Zopiclone has a half-life of around 6 hours, as do pregabalin and gabapentin. Starting your reduction. Plan how many days you will have between reductions. Remember, the longer the half-life, the longer the gaps. Each reduction should be no more than one standard dosage of your medication. It is better for you to hold on a dosage than to push your reduction too fast. Reducing when you're not ready risks rebounding back up to higher dosages, and with most medications, this will increase your risk of overdose. Remember, this journey is not a race. You can take your time. On the day of your reductions, make sure you have an enjoyable activity planned. Try to keep your days structured. The less you think about your reductions, the easier they are psychologically. What happens at the end? No matter what drug you are stopping using, the effects of the addiction will continue past your last dosage. Even if the goal is to reduce to an agreed prescribed amount, there will be a temptation to use more. During this time, you will need to draw on the people, activities, and resources you will have identified when starting this journey. These together are referred to as recovery capital. You may also experience an intense desire to start taking the drug again. These are called cravings. We have videos available on both recovery capital and cravings to aid you with these issues. You will need to be mindful in the future if you are prescribed similar medications to keep to dosages and length of prescriptions for these substances. To cope with negative feelings during reduction. Recovery can be difficult. The first thing to remember is it's okay to feel bad physically or mentally. These feelings will pass in time. We advise using mindfulness to help with the emotional stresses you may suffer, alongside making sure that you have enjoyable activities and structure to your day. For physical symptoms, we advise symptomatic care. This means treating the feeling you are having, such as a hot shower for muscle cramps or chamomile tea for stomach pain. Advice for relief from these symptoms can be acquired from your pharmacist or your GP. For additional support, you can refer into our service. Working with one of our recovery coordinators will give you access to help with these feelings, including personal one-to-one sessions, peer support, and workshops which focus on different aspects of recovery. To refer into our service, you can contact us, Change Grow Live Nottinghamshire, on 0115 896 798. For more information, you can go to our website at www.changegrowlive.org. Also, please subscribe to our YouTube channel for regular videos on recovery. Stay safe.